back to another episode of the Young Professionals podcast. Sarge, who are we speaking with?
Luke, today we're speaking with Maddie Steele. Maddie is a registered nurse and midwife working in a tertiary hospital in Melbourne. Immediately after high school, Maddie enrolled in a double degree of Bachelor of Nursing and Bachelor of Midwifery at Monash University. After completing her second year of studies, Maddie took a gap year to travel the world before returning to complete her final 2 years of uni. Maddie graduated in 2018 with the dual qualification of registered nurse and registered midwife, which she is putting into practice in her current role. Maddie is passionate about providing women from all backgrounds with evidence-based information so they are supported and empowered during their individual pregnancy journey through each of their antenatal, intrapartum and postpartum periods. Maddie, welcome to the show.
Thanks for having me.
Oh, thanks for coming on. And thanks for giving us those hard to pronounce words at the end of your bio. That's it's thrown me off a little bit.
I was going to say, well done on pronouncing that, Sash.
Yeah.
Thank you. To jump straight into it, what is it, and maybe this is a little bit of a silly question from a nursing perspective, but what is a nurse, and particularly what is a midwife, and what do you do?
Yep. So as a nurse, which I haven't worked in for like the specific nursing role for about a year, but we provide, people with care who are in hospital. So their day-to-day care, if they need, bloods taken, dressings changed, things like that, depending on the ward, we'll look after them. And then a midwife is kind of where my more expertise is. We provide people, it's very different every day. So we can be working in a range of different areas. So the antenatal period, like what we were saying before, is so we'd see people who come in to us when they're pregnant. So that's while they're pregnant, and mainly that's through clinic. So at the moment with COVID, it's about half telehealth and half face-to-face, and we'll kind of check up with them how their pregnancy is going. If they've got any concerns, we'll make sure that all their bloods are done, and that anything that's abnormal on their bloods is picked up. We'll make sure that they've got all their scans booked in, that their scans were normal, or anything that needed follow-up needs follow or gets followed up. And also to make sure that, their baby's growing and that the mum's staying healthy throughout their pregnancy. Then the next area that we can kind of work in is called pregnancy assessment unit. So that's where women come in if they've got any concerns during their pregnancy or if they think they're going into labour, and we'll kind of assess them there. It's almost like an emergency for pregnancy, and we'll assess them there and see if they need, extra care during their pregnancy as a result of that, if they might need to be admitted to hospital while they're pregnant. Or if they are going into labour and we can say, awesome, time to go to birth suite or something like that, then the next area that we work in is birth suite. So looking after women while they're labouring and then delivering their babies, and is quite self-explanatory, that part. And that's kind of the well-known area of midwifery, I would say. The more famous area is actually delivering the babies. And then postnatal. So once they've delivered the baby, they'll have, around 3 hours on birth suite, and then they'll get moved to the postnatal ward. And so on that ward, we help them establish breastfeeding. We make sure that they're recovering from the birth well, that they, whether we will assess whether they need to be linked in with anyone else. So like a physio, or if they've got diabetes, if they need to see an endocrinologist to sort out their blood sugars after pregnancy and things like that. And then we help them, get prepared to go home and into the world with their baby. And then as well, midwives come and visit you once you're home to make sure that, your breastfeeding's all going well and you're sleeping well and everything like that. So yeah, that's kind of an overview.
It sounds pretty specialised. Do you work across all those areas in the hospital, or does a midwife specialise in one area and then maybe only chip into the other areas when needed?
Yeah, so at the moment I'm working across all the areas, and actually just the going home with people after we do in a few years. But as a junior midwife, so I've been working for 2 years, they like you to work across all areas. It gives you good experience and you get better understanding for the separate areas if you can see the continuity. After a few years, people can choose to specialise. Midwives can choose to go down the research pathway, so being involved in more research, or specialise in one area. So some people might say, cool, I'm just working birth suite now, or no, I'm just working the ward, or might want to really specialising, helping people with becoming like a lactation consultant. So just helping people with breastfeeding. But that's kind of, once you've had a few years experience in all the areas, then people tend to specialise after that.
Before that, do you want to just explain how you get into a job at a hospital like where you're at now? Is it a more formal kind of graduate style program, or is it more of a placement while you're at uni? Do you want us to run through how you actually get your foot in the door?
Yeah. So while you're at uni, your university will organise placements. So you have to do a certain amount of placements over the 4-year degree that mine was, or if you're doing, you can do a single degree in midwifery, and that's a 3-year degree. So your uni will organise placements at different hospitals through that time, and you'll make contacts that way. And then at the end of uni, it's kind of like similar to the VCE applications to unis. So you put in your preferences for hospitals, and then you apply to those hospitals, and then if you are lucky enough, you get an interview. So you can only apply to 4 public hospitals or as many private hospitals as you want, and then you can get interviews at those places. And then you submit your rankings of what you would prefer, and then they submit their rankings, and then it gets put in a computer system, and you will find out on the same day if you've got a job and where. Yeah.
And what are the pros and cons of both sides of the coin, being that the public and the private sides?
Yeah. So the public side is very much midwifery run. So we work in conjunction with the obstetricians, and we kind of are like one big team. So I know
what's an obstetrician?
Oh, sorry. An obstetrician is the doctors that look after women during their pregnancy. Yeah. So in the public hospital, it's very much where most hospitals now, I think, so they have teams. So say your team is yellow team or something, and there's a certain amount of doctors in that team and a certain amount of midwives, and it's very midwifery run, and you work together with the doctors. Private hospitals are the individual doctors, so individual obstetricians working there like you would for another type of doctor. Like if you were going to see an orthopedic surgeon to get your knee fixed or something, pregnant women see that one doctor throughout their pregnancy. They probably might not see a midwife at all, or maybe just see a midwife once during that pregnancy. Mm-hmm. And then they would only really see the midwives when they come in for labour. The midwives look after them during the labour, and then the doctor comes in and delivers the baby. And then once they've had the baby in private, it is more similar on the ward. So the midwives still look after them and make sure they're breastfeeding well and everything on the ward. And they are cared for. They've got kind of like one doctor that's ahead of their care rather than a team looking after them in private. Yeah.
Matt, something that we really like to kind of explore with different roles is the differences between what you expected the job to be like when you're, say, at school or coming through uni, and what it actually is like once you get into industry. Do you want to talk to some of the kind of the good and the bad things that are different to what your expectations were before you got in there? Yeah.
So I kind of had no idea what a midwife was at all when I was in school. Like I think a lot of people, most teenagers haven't really had to deal with someone having a baby or looking after people having babies at all when they're in school. So I kind of wasn't really sure and got into the degree that was a double with the nursing. So I was like, I may as well do it. And so my expectations, I didn't really have many expectations of it. I kind of thought that doctors did most of the care for women. I didn't realise that in public, especially pretty much it's the midwives doing, the majority, especially of normal pregnancies, like people who are well during their pregnancy. So I think that was a big shock to me that, if you're well during your pregnancy, you might see a doctor once, like the whole time from when you get pregnant to when you go home. And that midwives have a lot of autonomy. We're not so much like, like obstetric nurses or anything. We've got a lot of say and a lot of autonomy, and which is great, something that I really like. I like being able to say, I think this person has this and let's do this. What I think once I found out what midwifery was, I kind of was like, oh, it's awesome. We get to go and, cuddle babies and deliver babies, and it's like a pretty fun job. I don't think I realised quite how hard work it was. Like some days it's great and you do get to cuddle babies, but other days it's like You will be working from the start of your shift till late, like you'll be working after hours and you might not get a break. You might not get to go to the toilet that whole time, which they're trying to get that better, but it is a bit of that environment. It's really hard to leave someone when she's in pain and having a baby and you can go, oh, I just need to go have a cup of tea. Like it is hard to do that. So I think that's one thing that I didn't expect. The other thing that isn't talked about much at all kind of in life is the rate of, like, there is quite a high rate of stillbirth and even in Australia, so 1 in 135 women will have a stillbirth, and which doesn't sound that high, but it is still quite common. Like I would say that a lot of the time, most days we have someone having a stillbirth at our hospital, and our hospital, we do see them more frequently than average because we're a high risk hospital, but it is something that happens and isn't really talked about, in society. And that's something that I don't think I was prepared for until I got into the workplace. And it was something that I was like, hang on, I'm 23 years old and I'm trying to support someone who's lost their baby. Like, how I've got no experience in that. So you kind of need to work out other ways to work through those situations and support
just
those
on
women.
that. How do you adapt to that? Like, and maybe come at the question from when you do a job, there's many things that you don't actually know about the job. So like when you get to the job and you find something that is a bit weird or different to deal with, how do you think one can position themselves best to deal with that?
So I think I did lots of reading and like listened to as many interviews as I could from women who'd experienced it and gone through it. And it's also about, your people skills. So like, which I think is very similar to most jobs. Like you've got, like, we can walk into that room and someone going through that experience will have a completely different experience to someone else going through the same experience. So it's kind of very much about people skills. You walk in and it's the same as someone having a baby who hasn't died, who's alive. You walk in the room and go, okay, you've got to be able to kind of read them and assess their situation. And I think the biggest thing is as well, not being sympathetic, but being empathetic. So you're there to look after this person and to facilitate as the best possible outcome in the situation that they have. So you've got to, so no one wants to be felt sorry for in that situation. People want to be looked after and shown how to best, deal with that situation in the way that suits them, I guess. So it's very much about people skills.
Are there any specifics that you can talk to that, you can get super granular in this in terms of the way that you would approach a situation like that? And the context behind that question is we spoke to a doctor who I don't think it's been released yet, but might be by the time this one comes out. But he spoke a lot about that bedside manner and how to really develop that. And it's often the small things like sitting down next to the patient that you're talking to and things like that. Like, are there little things that you do that make that, encounter better for everyone?
Yeah. So the first thing that I do when I walk into a room is we get this thing called handover. So from the staff looking after that person in the shift before you, they then hand over everything about that person. And what I say to the woman when I walk in is, you guys, you're involved in this too. So if we've missed anything or if you want to include anything, let me know. And then after we've got the handover, so that normally goes for 5 minutes, I say to them, okay, what do you want me to know? Like, what do you want to get out of today? Like, this is, and so that they feel like they have a say and control in their care. What might be, one person, their ideal birth might be a cesarean and just like no labour, cesarean. And then another person, their ideal birth might be no pain relief, doing it all natural and everything. And then everything in between. So there's no ideal birth for one person. So I guess letting them tell you what works for them and then saying, okay, cool. So I'm going to try and facilitate that for you. And also educating them on, the realisticness of that expectation and kind of saying, okay, cool. So I know you want, no pain relief and maybe no monitoring during your birth, but these are the reasons why we would recommend something else. So kind of really tailoring that to what they want and making sure I'm aware of their wants. And at every point, making sure that they know why everything is being, why we're recommending things. So rather than just saying, oh, you need to do this now, saying, this is what's happening. And so we would recommend this, but what do you think? And making sure that the woman is always kind of in charge.
It sounds like it's even going like a level above. You really know your stuff, but it's putting your confidence to know that stuff, but in the context of being told what the desired outcome is and then giving your best advice to make that desired outcome the most comfortable that it can be. Like it's going above and beyond being the subject matter expert and then having to kind of like mold that to what someone else wants. Yeah,
definitely. So the word midwife actually means with women. So it's very much on that. And we talk about that as midwives all the time is it's not about us. Like as soon as I'm in the room, like all my thoughts, my opinions, everything just goes out the door. And it's all about that. Yeah, exactly like you said, that woman's opinions and what she wants. And then just giving her the information to make the decisions to get there really. Like I'm an information source. Once I'm in that room, I don't have opinions or anything like that.
Did someone tell you had to think that way or did you have to kind of learn that yourself?
A little bit of both. Like it is something that's very kind of ingrained into you when you're a student, but I also think it's kind of part of the job. Like no one, like you kind of need to think like that to be able to, do this job. Because I think if you walked in and said to a woman, this is how we've got to do it, this is what we're doing, she'd just say, nah, get stuff. Like no one wants to be told what to do. It's the most important day of their life. And, you've got to make it about them. Like we're not really important once we're in that room. And I think you'd work it out pretty quickly if no one told you as well.
I think it's an important perspective that anyone in kind of any service industry at all can really take on. It's like it's about the in your case that the client or the customer or whatever is the person that's giving birth. It's like this interaction is about them, not necessarily about you.
Yeah, exactly.
But just before we jump back to kind of your education journey and getting into the studies, do you want to just take us through what a day in your life looks like, say, and in terms of real kind of intricacies in terms like what time does the shift start? How long does the shift go for? What's your kind of weekly load look like?
Yeah. So shifts go for 8.5 hours. So they'll either start at and you've got to get there a little bit before the start. But so they'll either go from 7 a.m. till 3:30 p.m., 1 p.m. till 9:30 p.m., or the night duty, which is 10.5 hours. So 9 p.m. till 7:30 a.m. So they're the 3 shifts that we work. In clinic, it's more like 8 till 4. Which is quite nice to have once a week. And we can work any day of the week, 24 hours a day, 7 days a week, every day of the year. So we get our roster about 2 months in advance and we kind of just work around that. So I think our hospital tries to give us 2 weekends off a month. So I kind of work about half the weekends. And that's kind of in terms of my shift,
Are you 8 shifts a fortnight? Because my sister's a nurse and that's her program. Yeah, so 8 shifts a fortnight, which I would recommend for most people. It's shift work is a lot different to 9 to 5 where, you get exhausted. Sometimes you'll get home at 10:30 at night and need to leave again at 5:30 the next morning and you're on your feet all day. So 8 shifts a fortnight works really well. Some people work less and then some people go up to full time. I'm still at 0.8. I thought about going up to full time during COVID and now that we can see friends again, I kind of like that social life balance. So I think I'll stay 0.8. But yeah, and then when I get to work, so depending on where I am, I'll talk about birth suite because that's kind of the area that I'm incidentally finding myself most at the moment. So I'll get there, you'll get a handover for every woman that's in birth suite. So that's kind of the first 15 minutes of your shift with your whole team that's on that afternoon or that morning.
How many patients are on birth suite in any given day?
Yeah, so in our hospital we've just expanded to 12 beds. So there will be full, then plus there'll be the people who are kind of waiting to come in. The thing with birth suite is sometimes everyone will go into labour at the same time and then sometimes there might not be that many people in labour.
Wow.
Yeah.
That's my worst nightmare.
Yeah,
it means you have more patients too.
Yes. Yeah. So sometimes it will get to the start of the shift and we'll go, oh, there's like no one here. And then, 20 minutes later, we will have had 10 people calling up saying they're in labour and it's all systems go. So Yeah, so it can be a bit unpredictable. You've got to be able to adjust quite quickly. And then you might be, so on birth weight, you would then go meet the woman, get that handover like I was talking about before, and stay with them while they're having a baby and support them through labour, whatever they want, pain relief wise, and how they want to do it, and then deliver the baby and then get them over to the ward so that they can have their postnatal care. A shift on the ward is slightly different. You get your handover, you'd have 4 patients, not including the babies. So you get your handovers at the start of the shift. I kind of like to take 15 minutes to make sure I know what's going on, look through everyone's bloods, everyone's results. And then a shift on the ward is basically a lot of supporting breastfeeding and making sure that people have appointments to follow up. We really liaise with all the allied health on the postnatal ward, making sure that women are seen by lots of different people. And I would say I almost feel a bit like a case manager sometimes on the ward, making sure that people are seen by lots of people. Yeah.
Oh, it sounds like a pretty exciting place to be.
Yeah, it's great.
Just jumping back a few steps or to what you studied. So you studied your Bachelor of Nursing and Midwifery at the same time.
Yeah.
My understanding is that that's it's a good degree in the sense you get a lot of practical experience. Do you want to talk to what studying those 2 degrees was like?
Yeah, so it was great. So in the first year, most of our class time was at uni, so we didn't have a whole lot of placements. I think we only had 2 weeks. Second year, I would say it was almost split in half from memory, trying to remember back. So I did what's called an integrated placement. So I did 3 days a week at uni and 2 days a week at a hospital for most of second year. And then you have extra placements. So in uni holidays, you'd be on placement as well at a hospital. So it's very full on second year, managing all the placements and everything. And then third year is quite similar, and fourth year is kind of consolidating everything at uni and then also having placement. So it is a balance. It's full on. We have a lot of contact hours for the double. So kind of 5 days a week you're either at uni or on placement. Yeah.
Matt, a lot of people that have come on have spoken about the I guess importance of getting practical experience through like a part-time job or even a full-time job when they're at uni, because they can balance that with their workload. Like, obviously you get placement through your degree and that kind of solves that problem. But do you want to talk a bit about how you kind of balanced your uni life balance and work and friends and all of that during a degree that is quite demanding of your time?
Yeah. So I had 2 part-time jobs while I was at uni. So one of them was in nursing homes. So I worked for an agency as what's called a PSA. So I'd go into nursing homes and help, washing patients and, helping them eat their meals and things like that. And
did you have to do a course to get qualified to do that?
No. So being a nursing student, that kind of gives you the qualifications once you finish your first year. Yeah. And that was great because it was casual work. So I could pick up shifts when I had time. So a lot of them would be on a Sunday or a Saturday. And so that was really good flexibility wise and great learning experience. Like going into it, I think is the attitude that most people have going into nursing. It's like, oh, don't know if I want to do aged care, but it was great. Like old people are way more interesting than young people. Like they've got like 90 years experience.
And
like,
no filter. They don't care.
Exactly. It's great. and I mean, some of them might not be true stories. Like they make up a lot, but it's great. Like you learn so much from them and the people skills that you learn from them and, learning to care for, like we're all going to end up there. Like hopefully you hope you end up there actually.
There's been a few people that said that actually. It was Matthew Clartis, the podiatrist that we spoke to. He did he cut his teeth or cut his feet rather in kind of old people's homes. And he said that was the place where he really learnt how to really be empathetic with someone that you don't have a lot of commonality with. Did you find that? Yeah,
100%. Like your grandparents you talk to and they're your grandparents and it's great, but it's very different talking to someone who is really vulnerable, but, especially they might mentally be all there, but just can't, they can't live on their own anymore. And it gives you, and talking to them is like the best experience ever. Like it gives you this insight into their life, and we are all going to end up there. Like, we can't help it. We're all going to end up there one day, and you do realize, like, these people are not people who have spent their whole life in a nursing home or something. Like, they've had a life and they've had a family and they've grown up and they've had a career of their own, a lot of the time really successful careers. And the thought of, you know, how people kind of look at them in society today, like the elderly, it's quite shocking when you go, hang on, but that's going to be us one day. And everyone just ends up like that. And
on that, it teaches you to get to know someone and understand someone that you have no knowledge about. Like, you go in there, you don't know anything about this, whoever the old person is.
Yeah.
But for you to be able to provide them care and enjoy giving them care, you really need to get on their level and understand them. And you don't have to agree 100%. With them, but you just need to learn a bit about them.
Yeah. And, you know, like I said, they're way smarter than us. Like, they've been around for like 90 years. We've had like 25 years experience. We've got nothing. Like, they know a lot more about the world. Yeah.
On that experience that you got, say that part-time job, was that, or is that something that is assumed of nursing students, or is that something that you kind of, you were doing something that's above and beyond kind of the standard approach?
I don't think it's assumed. I do think most people get part-time work in that, and it does really help. It not so much in that it's going to give you contacts, but it really helps in it looks good on your resume really as well. Like, it's, if you're able to go in and provide those basic nursing skills, so, you know, helping someone get dressed, helping someone wash someone, look after someone like that, they're the basic nursing skills that you're going to use no matter where you work, everywhere. And so it does show that you've got them down pat. And yeah. Yeah,
that was going to be my next question, in terms of what does it take to make yourself stand out as a candidate to go into, you know, a nursing kind of, you know, the program you spoke about in terms of that ballot and whatnot. Like, we've spoken to a lot of people in kind of white collar corporate jobs, and we understand what it takes to get into a grad program there, but like, what sets someone apart on a piece of paper and then in an interview at a hospital?
Yeah. So I think it is very much about the work you do. Like, a lot of jobs I know are very much about who you know, and that helps you get in. And it, to a certain extent, that can help in nursing midwifery, but not really. Like, they kind of look at, so if you've done any volunteer work, if you've done any extra papers, and then a lot of it is on the interview actually as well. So in the interview, you can really show that you've got, you know, those people skills, that you can communicate well and that you can empathize with people. And also in the interviews, they're quite in-depth, the interviews. For nursing midwifery, you often have a scenario as well, like an emergency scenario that you need to run through, and showing that you've got that knowledge and that you've done the work to get that knowledge, and that in an emergency you don't need to go, oh, hang on, I need to go check the protocol or something, that you know what you're doing and you can stay calm. They're the main things that are going to help. Yeah.
What was the prep like for that interview? And the reason why I ask is we were actually speaking to someone yesterday who was like, people will put in hours into their resume or their cover letter or whatever, and then spend 5 minutes prepping for the interview. But particularly in health, from the sounds of things, like, if you're throwing a scenario, it's like, you better well have practiced that. Like, what did your prep look like?
So it was a lot. So basically a lot of fourth year was prepping for these emergency scenarios, not only for the interview. Like, at the end of the day, you've got to know what to do in an emergency, because it's going to happen at work.
It is a life or death situation.
Yeah. So incidentally, you prep for those scenarios anyway at uni, and then going through them. So we, you know, would meet up with uni friends in a group and go through those scenarios and make sure that we knew what to do. I had the great thing with a lot of medical stuff is there's a protocol, and you start here, and if this happens, you just follow the path. So I had, you know, my boyfriend who has nothing to do with anything medical at all, but he could just read it off a piece of paper and make sure that I knew what I was talking about and that I was saying the right things and knew what to do. So it was really quite intensive. Like, I practiced those scenarios and the main scenarios, and read lots and watched lots of videos for months to prepare for the interviews. The cover letter wasn't as important to me, but it was really important to get an interview. So I did, I say it wasn't as important, but I was quite lucky. I think I did get the help of someone who interviews students. So I I got her to help me write my cover letter, and that was very helpful. And also we all sent each other's cover letters so that you can read what other people have gone and go, oh, I like the way they worded that, and things like that, I think was really good. I feel like a lot of nurses and midwives were very supportive of helping each other get there.
Matt, I've got a question about more of the industry, and I might be completely wrong in terms of how you can approach people, but something that I found when we were doing our cover letters and stuff at uni, it's that, you can sit down with your mates, but it kind of gets to a point where it could be the blind leading the blind almost. It's like, oh, that sounds great, but we all think it sounds great, but it's not actually. And it really, my thinking on that really changed when I started reaching out to junior people in the industry and be like, hey, can I do half hour interview prep with you? Because you've actually just been through the real thing. Is that something that would be received well? Say, for example, if a student was to reach out to, maybe not you, because we might get hundreds of people going your way, but is that something that would be received from a junior kind of nurse in terms of people asking questions like that?
100% that would be. So I emailed, so I was quite lucky in the sense that I knew a lot of people who were kind of the year above me, so were in their graduate year. Because I had stayed back a year once I did my gap year. So I emailed a lot of my friends in the year above who were doing graduate years at hospitals that I really liked the look of, and said, hey, do you mind if you just like give me a bit of a hand with my cover letter? Most of them just sent me their cover letters as well. And you kind of can take bits that you like, and they're obviously cover letters that got them an interview at that hospital. So obviously you can't copy them or do anything like that. Like my experiences were very different to the experiences that they'd had. But just in terms of like the layout and the areas of their education that they focus on, most hospitals only want a one-page cover letter. So you've got to be very good at keeping everything very concise.
What if you can throw your mind back, like what were some things that you spoke about in your cover letter or made sure that were in your resume or you spoke about at interviews?
Yeah, so a lot of it was, so I think I spoke quite a bit about my experience. So I did like a volunteering trip to Africa when I was a student. So I spoke about that, but I also spoke about kind of how I wanted to be a midwife, like what values I wanted to bring to that hospital and to that job, and what I wanted to, bring to my own personal kind of style of midwifery. And I mean, it worked. I got interviews for everywhere I applied. So I think for me, that's what worked.
I think more generally I like the fact that you say you brought your own personal style to it. I think people sometimes fall foul of leaving that at the door or not including that personal style in these cover letters. And I think they're really missing a trick there, because when these businesses or hospitals or whoever it might be go to employ someone, they want to employ a person, not a robot. Yeah,
exactly. And so it's especially given that's like what hospitals are looking for as when we do all come from a very similar, like we all do this placements, a lot of us do those kind of PSA jobs. It is what makes you stand out, is saying, hang on, this is who I am. I'm a person that's going to be helping to look after people.
When you were considering, really at any time since you were kind of a kid, was there anything that you consumed in, the media or a book or a movie or a podcast or anything like that kind of gave you a really good insight into what working in the medical field was like, or that you were inspired by?
Yeah, so I was really lucky. Both my parents and my dad both work in the medical industry. So my dad's a doctor and my mum's a nurse. So seeing them, we used to, when we were little kids, go in on Christmas morning with dad to hospital and like see all the patients. So I kind of, just through growing up like that, always knew that's what I wanted to do. Like I loved being there and talking to all these people who you wouldn't get to meet normally. Like it's the best thing about our public system. You'll be talking to someone who's grown up in Southeast Melbourne one day and then someone who's grown up in Sudan the next day. And it's awesome. So that's what drew me into the medical profession. Like I can't think of another career that I knew of that I could be exposed to that many different types of people. And I didn't really know what was what a midwife was. But then talking, like all our mums have had babies, all our grandmas have had babies. So as soon as I was like, oh, this is kind of cool, and started talking to people about it, like everyone has a story, and it's amazing. It's like, it's really weird. It's like you tap into this world that you didn't know existed before. And, you ask any woman who's had a baby, what it was like, and 99% of them will go on for 45 minutes about their experience. And it's just really cool listening to how every experience is so different. Yeah.
Mads, what advice do you have for students who are thinking about doing midwifery?
So I would say, just go for it. Work really hard and make sure that you know your basics. I used to say to myself, I don't want to be stuck in a room one day, and because I didn't read this piece of paper or try hard on this assignment, I not know how to take care of a patient. So that was kind of a good scare motivation for me to actually work hard at uni. But also go into it remembering that, it's not about us. It's about us being able to care for other people. But at the same time as that, you've got to really be careful of not getting fatigued. So then learning to leave your job at work, and being really caring and giving everything to other people at work. And then when you get home, having a little bit of self-care routine and learning to look after yourself as well.
I think that's super important. And maybe just one last thing to leave on, because you touched on it before in terms of the gap year. Like, is there any, I guess, words of wisdom to kids in, at any stage in school or uni, in terms of having a bit of, like, you can reflect on your progress and whatever, but it's important to also take a break and go and experience different cultures and experience, outside of your Melbourne or Sydney or Brisbane or wherever you are bubble. Is there anything there?
Yeah, like definitely. I recommend, like, having a year off was like the best thing ever, and it actually made me such a better midwife. Like I traveled for 6 months of that, and 3 months I did with friends, which was great, like fun. It's like something that I can say I've done and I've had those years. But 3 months I did on my own, and I think that was like, for me, it was a real turning point from when I feel like I was like a kid to actually growing up. Like I had to meet someone at breakfast who I had no idea who they were from. They could have been from another country, any background, and you just start chatting and you learn to make friends with people who you have absolutely nothing in context or in common with. Kind of like talking to old people in nursing homes. Like you just like talking to people who were from a completely different world to what you're from, I think was the skills that I got out of that gap year. And I use it every single day when I talk to people, because you walk into a room with a patient and you could have nothing with them, but you've got to spend 8 hours with them, supporting them through one of the toughest days and best days of their life. So yeah, you've got to really be able to talk to people and get on common ground with them really quickly. Like it can't take you a long time. Like you've got to be able to get common ground with them in the first 5 minutes. So
could not agree more. And Sarge and I speak about that a lot, and that's something I got out of my travels. And I read this post, I can't remember where it was, somewhere the other day, and it was like, next time you hear someone speaking broken English in your town, that's a reminder they also speak another language quite well. And that really rang home to me, because I remember being in other cities and it's like I couldn't speak a word of what they were saying. You're completely lost, but you find your way around. And it sounds like if you're in a hospital ward trying to speak with someone who might not speak perfect English, it's like, because you've traveled, you've got an appreciation. It's like, well, they've got this whole other background that you don't have an idea about. So no, couldn't agree more. And I think that's a great place to leave it, and quite an inspiring one as well. You certainly bring a lot of good to this world in what you're doing. So it's really nice to hear, and thanks for coming on and sharing the story with us.
Thanks so much for having me, guys.